Have you ever wondered what conditions are grouped under the name mast cell disorder, and why? Then please continue watching. The scientific community has been studying mast cell disorder, or MCD, for many years. But the criteria for defining how they are described has been a topic of debate among researchers, also for many years. This debate has resulted in several competing ways to describe and classify MCD. But thankfully, these days, MCD is generally classified by a World Health Organization (WHO) structure, which reflects how each MCD type develops at the cellular level, described as its cellular pathogenesis. The three top-level MCD classifications by the WHO are clonal, non-clonal, and genetic. Let's first take a look at clonal MCD types. A clonal MCD occurs when there are too many mast cells with the same abnormal genetic code, as one mutated cell grew out of control. This overgrowth causes an accumulation of mutated mast cells in different organs of the body, which can result in abnormal mast cell activation. Some types of clonal MCD include systemic mastocytosis, cutaneous mastocytosis, malignant mast cell neoplasm, and monoclonal mast cell activation syndrome. The second group of MCD types are non-clonal. A non-clonal MCD is not due to an overgrowth of genetically mutated mast cells. Instead, they occur when individual mast cells are mistakenly activated or behave improperly, leading to abnormal mast cell activation. The two most common non-clonal MCD types are mast cell activation syndrome, MCAS, and idiopathic anaphylaxis. The third kind of MCD is quite unlike the other two types. It only happens when someone gets extra copies of the alpha tryptase gene, TPSAB1, in their body. This MCD, called hereditary alpha tryptosemia, H-alpha-T, causes increased levels of the mast cell chemical tryptase in the blood, which can cause abnormal mast cell activation. Finally, a discussion on MCD types would not be complete without mentioning another group of conditions. These more advanced forms of MCD belong to the clonal category of systemic mastocytosis, but they differ from others due to their link to hematological neoplasms, a type of cancer. For example, in mast cell sarcoma, MCS, mast cells become cancerous and start to grow uncontrollably, forming a tumor. In aggressive systemic mastocytosis, ASM, the accumulation and activation of mast cells are more severe and can cause damage to tissues and organs. SMAML stands for systemic mastocytosis with an associated hematological neoplasm, specifically acute myeloid leukemia, AML. In this advanced MCD, the abnormal accumulation and activation of mast cells in different organs of the body are associated with the development of AML, a type of blood cancer that affects the bone marrow and blood cells. In summary, there are three top-level MCD types: clonal, non-clonal, and genetic. There is also a subgroup of more advanced MCD types under systemic mastocytosis. Because there are so many types of MCD, and similarities in features, symptoms, and treatments, diagnosing MCD can be difficult. However, even with these difficulties, the WHO classification shows how each type of MCD is classified on a cellular level, which helps to diagnose and treat patients accurately, and improve their quality of life.
This was a video presentation from the PhD research of Kylie Veal-Southeran. Please check out our other videos in the series on the Mast Cell Disorder and Wellbeing channel on YouTube, or the MCD and Quality of Life page on Facebook. All links and references are in the video notes.